I did my medical school training at a premier institution in India, and then I went to Johns Hopkins University in Baltimore, where I did a few years of cardiovascular research and public health training. And subsequently, I went to Pennsylvania, where I did my residency, and I was chosen to be a chief resident over there. And then I went to University of Kentucky in Lexington and finished my cardiology fellowship training over there. Cardiology has always been my passion, and what excites me about this is that over the past nearly 4 decades, we as a community have made a lot of gain into cardiovascular research and clinical care. But it still remains the leading cause of death in the world and in the USA. And so I wanted to remain on the forefront of clinical care of patients with this really profound illness that we have, an endemic illness, and that is the reason why I chose cardiology. I am a general clinical cardiologist, so I take care of patients who have coronary heart disease, congestive heart failure, valvular heart disease. These are my areas of interest, and I do see patients in my clinic, and then I evaluate them, and depending on what their symptoms are, we would progress with testing for those patients. I have a special expertise in advanced echocardiography and nuclear imaging, and I'm board certified in nuclear imaging in addition to cardiology. Nuclear imaging is a pretty sophisticated tool. So, for example, if someone comes in with chest pain and there is a concern that they may have a possible blockage, then rather than put each and every one of such patients through an invasive cardiac procedure, what we can do is a form of a stress test where we would make them either walk on the treadmill or give a chemical for a stress, and then we would take pictures under the camera. What these pictures do is they look at the blood flow to the heart muscle, and if on the imaging I see that one portion of the heart is not getting enough blood, that is a clue to that part of the heart having the blood vessel that has a blockage, and that would be a clue to subject them through a heart catheter procedure. I want my patients to know that whenever they would come to me in my practice, they would always get compassionate care and diligent care. Whether they are coming in with simple advice that they need for cardiovascular prevention, or whether they come in already with some complex cardiovascular problems, we will always give them our full attention and state-of-the-art care.